your liver works silently, until cancer strikes. Liver cancer is one of the fastest growing cancers, yet most cases are preventable. What's attacking this vital organ? How can you stop it before it starts? And what breakthroughs are saving lives? Let's uncover the truth. Causes and prevention. Liver cancer doesn't happen overnight, it's often the end result of long-term damage. Here's what triggers it. Chronic hepatitis B or C, which causes 80% of cases. Cirrhosis, a scarred liver from alcohol or fatty liver. Aflatoxins, mold toxins in spoiled food. Obesity and diabetes driving fatty liver disease. Smoking and heavy alcohol use, which doubles the risk. Liver cancer often begins as small tumors within the liver. It has the potential to invade blood vessels, spreading to the lungs or bones. Unfortunately, many people experience no symptoms until the disease is quite advanced. Liver cancer rates have tripled since 1980. This alarming rise is mostly due to undiagnosed hepatitis and fatty liver disease. Up to 90% of liver cancers are preventable. Here's your defense plan. First, vaccinate and treat infections. If you haven't gotten it, the hepatitis B vaccine is crucial. New drugs can cure hepatitis C, eliminating the virus in just weeks. Next, let's talk about lifestyle armor. Limit alcohol to 2 drinks per day for men and 1 for women. Avoid moldy foods like improperly stored nuts and grains. Eat liver-friendly foods such as coffee, berries, and cruciferous vegetables. Regular exercise is also essential as it fights fatty liver disease. Finally, there are some medical must-dos. If you have cirrhosis, monitor it with ultrasounds every 6 months. And don't forget to control diabetes and obesity, as they are key triggers for liver cancer. So let's talk about the early warning signs of liver cancer. Unexplained weight loss can be one of the first indicators. If you're losing weight without trying, it's something to take seriously. Next, yellowing of the skin or eyes, known as jaundice, is another key sign. This occurs when there's a buildup of bilirubin in the blood. A swollen abdomen can also be an early warning sign. This might be due to fluid accumulation or an enlarged liver. Lastly, if you're experiencing pain in the upper right part of your abdomen, it's important to get it checked out. Remember, these signs don't necessarily mean you have liver cancer, but they do warrant a visit to your doctor for further evaluation. Liver cancer is tough, but new treatments are doubling survival rates. Surgical options for liver cancer include liver resection, which involves removing the tumor along with surrounding tissue, and a transplant, which is an option for early-stage cancer and cirrhosis patients. Now let's talk about non-surgical breakthroughs. Ablation therapy can burn or freeze small tumors. Targeted drugs like Lenvima and Nexavar work to block tumor growth. Immunotherapy such as Keytruda is used for advanced cases. Lastly, radiation embolization uses tiny radioactive beads to kill tumors. Let's discuss survival rates for liver cancer. For early-stage localized liver cancer, the 5-year survival rate is 30%. For advanced metastatic liver cancer, new drugs are extending life 2 to 3 times longer. Meet Carlos, a hepatitis C survivor who was cured before cancer developed. Your liver is a silent warrior, but it needs your protection. Get vaccinated, control hepatitis, and avoid alcohol abuse. Share this video, it could save a life.